Hello friends, you are very welcome to this video. My name is Dr. Saeed Kazmi and this is my YouTube channel. So let's start with the case. A 14 years old boy, he presented to the emergency department with a 2 to 3 day history of mild to moderate grade fever. He had no other symptoms, but in the last 24 hours he has come up in a florid rash all over his body, which is there from his face down to his toes, and it's also there on his genital areas. He denies any cough, any vomiting, any diarrhea. His mom says that he came to UK in the last 4 weeks. He came in the last week of December, and he comes from Zimbabwe. He has been screened for TB and does not carry any TB infection. His immunization history is not very much known, that though they say he has been immunized against certain diseases in the past, but there is no documented record for that. Other than that, his past medical history is insignificant. He denies he's not sexually active. He denies any smoking or any recreational drug use. He's not using any medication for any reason at the moment, and he denies having any drug allergies. Now on examination, he is borderline febrile. His temperature is around 38 degrees Celsius, and his throat is mildly erythematous, slightly congested, though there is no florid tonsillitis. Chest is quite clear to auscultation, and rest of the examination, including gastrointestinal system, musculoskeletal system, and central nervous system, is unremarkable. The skin examination shows that he has got a papular rash, discrete rash, which is almost present on all parts of the body. It's there on the face, it's there on his chest, abdomen, back, is there on his arms, and is there on his thighs and legs as well, and it is also present on his genital area. So this is a papular rash. 2 to 3 millimeter are the largest lesions. They are fleshy looking. They've got a central punctum, and a few of them are umbilicated lesions as well. A urine dip is done at triage, which comes out to be negative for anything. So the question is, what is the diagnosis? So before discussing the diagnosis, just to remind you that those of you who are watching my channel for the first time, a subscribe would be fantastic, because it really helps. And if you like my videos, please share it with your friends, press the like button, and also press the bell notification icon, so whenever I upload a new video, you're always on board with me. Okay, so I have already described this case to you, and it's time for you to answer me. What's the diagnosis? So yes, you are very right. The diagnosis is, this is acute Molluscum contagiosum. So acute Molluscum contagiosum is basically a florid pox virus rash, which usually occurs in children around 10 to 14 or 15 years of age, most common in teenagers, and usually happens in those people who have got a bit weak immune system, though nevertheless it can also happen in apparently healthy children as well. This pox virus is spread by direct contact, so if there is sharing of infected clothes, towels, it can spread. It's also spread by direct intimate contact. It's also transmitted by sexual contact. And sometimes what happens, there's sort of a phenomena which we call as auto-inoculation. So if there is a lesion and the child presses it, and the material that comes out, it contains all the viruses. So if it touches the surrounding area, it would lead to more viral lesions, skin viral lesions, which as I told you, we call it as auto-inoculation. In most of the cases, it might be limited to certain parts of the body. So you might see it in the axilla, you might see it around the neck, you might see it around the genital or the pubic area. But sometimes children can come up with a florid rash where there is pox virus all over the body. As I told you, that this can happen with if somebody has been sharing clothes or has been in intimate relationship. But sometimes it can also happen if somebody's immune system is weakened and somehow they come in contact with somebody who might be carrying pox virus, as I told, direct skin to skin contact or through towels and sharing of the blades and things like that, they can come up in a florid acute molluscum contagiosum rash. It's very important that those who have got molluscum contagiosum always screen them for underlying immune disorder. So if they are, let's say, malnourished, obviously that is a secondary malnutrition, and that might be one of the contributing factors for this rash. But some people might also have got primary immunodeficiencies, especially the T cell mediated deficiencies. So just look for that. So full blood count, like, can give you an idea to see if there is like a decrease in the lymphocyte counts, which might compel you to do some further testing. Also, as in this case, the child who is coming from a developing country, it's very important to screen them for HIV, because HIV virus infection also leads to a decrease in the immunity, and then they can come up with these types of infections. As far as the treatment is concerned, you have to reassure, because this is a self-limiting condition. Most of the time it can take anywhere between 6 months to 3 to 4 years. Just tell them it's not that sort of a viral rash which will go away in a 7 to 10 days. It's going to stay for some time. The important thing is that they should not share their clothes and other things with other people. They should not share their towels and other things. They should not press and squeeze the lesions, as it would lead to further auto-inoculation. They need to have a good personal hygiene. They need to have good nutrition, and if there is any component of underlying immune deficiency, that needs to be addressed. So if the immune system is boosted, automatically these lesions would clear up, as I told you, somewhere between 6 months to 3 to 4 years. Obviously, where the lesions are so much heavy and there is sort of a disfigurement, or there is concerns about appearances, then referral to dermatologist can also be considered, because cryotherapy and some forms of skin therapies can actually treat some of the lesions which are there on those parts which the people they don't like. So again, but that would depend from case to case basis, and obviously if needed that can be done. But as I told you earlier, that most of the cases won't need any treatment, and with better personal hygiene, with better nutrition, with boosting of the immune system, the lesions would spontaneously clear up anywhere between 6 months to 3 to 4 years. So this sort of a reassurance is very important. This type of explanation that how long would it take is also very important. Otherwise they might be going from pillar to post, like looking for different solutions, which in most of the cases they don't work. But obviously if this is concerned, the better thing would be just to refer them to the dermatologist in the very first instance. So this was all about acute molluscum contagiosum and its presentation. I hope you have liked this short video. If you have got any questions related to molluscum contagiosum, you put your question down in the comment section below and I will answer that question. Thank you very much, and bye bye.